Hi everyone, this is Matt. Today we're going to continue the series on interventional electrophysiology, and the topic for today is atrial fibrillation. 5% of everyone over the age of 65 is likely to have, at some point after that, atrial fibrillation. Atrial fibrillation is a heart rhythm disturbance that functions in the following way. The pacemaker of the heart, that is the SA node, is an atrial fibrillation on vacation. What's happening in atrial fibrillation is that there are up to 400 or more signals from the atria being generated. This is a very abnormal situation, and when you figure that your normal heart rate is 60 to 90, 400 is much too fast. It may be less than 400, but it can be 400 or more. There are some really basic problems with atrial fibrillation. The heart in general beats effectively when it's well coordinated. That is, when there is a one-to-one relationship between the signals generated by the pacemaker of the heart and the pumping of the ventricles. That is efficient. Atrial fibrillation is uncoordinated and inefficient. So what happens is all these extra signals overwhelm, to an extent at least, the atrioventricular node, the AV node, and too many signals are being conducted to the ventricles, which can lead to a very fast response of the ventricles. And it's not like a boom, boom, boom of the conduction of signals from the atria to the ventricles. It's more like this: boom, 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 boom. Very fast, irregular. And this can lead to a stroke. Why is that? Because this irregular contraction of the ventricles, as in fluids, any fluid, and blood is a fluid, causes current changes, flow changes, and those flow changes can cause blood clots. And guess what? From the left ventricle of your heart, blood is pumped up to your brain, and that is really dangerous. And this is why atrial fibrillation needs to be treated. So, treatment of atrial fibrillation is, there's a few different strategies. One is to return the heart to a regular rhythm. That can be done chemically with specific medicines. It can also be done electrically through a delivery of electricity through the chest wall to the heart to basically shock it a little bit so the pacemaker of the heart takes over again. Another strategy, if the cardiologist cannot return your heart back to a normal rhythm, is to, one, thin your blood so that decreases the risk of a stroke, and two, help to control the rate. So there are specific medicines that are given. Warfarin is the most common, to thin the blood such that you are at lower risk for a stroke. The heart rate control medicines, there are several of them, but beta blockers are common. And those strategies help to minimize the risk for someone to stay in atrial fibrillation, or if they cannot be converted out of atrial fibrillation, to medically minimize the risk of a stroke. So again, many times people have symptoms. It again reinforces the need, if you have symptoms, fluttering in your chest, or you're weak, or you're dizzy, especially if you are approaching that age range of 60 plus, that you may have atrial fibrillation. And it's a serious, serious heart rhythm disturbance. And you want to get it checked on. And if you are in atrial fibrillation and they recommend specific treatments, it's very important that you follow your medical regimen, because this helps you from having a stroke. And that is really important. And that's it for today. Have a great day.